What is agoraphobia like? And how do you help it? What do we do about it? That's what I'm going to talk about in this video today. I'm Dr. Tracey Marks, a psychiatrist, and I publish weekly videos about mental health, education, and self-improvement. Agoraphobia is the fear of being in certain places where you have anxiety and you're unable to escape or get help. The Diagnostic Manual for Mental Disorders lists 5 kinds of places that you fear going to because of this issue of not being able to escape when you have anxiety. And the 5 scenarios are using public transportation like trains, planes, and buses, being in open spaces like parking lots, shopping malls, bridges, being in an enclosed space like a shop or a theater, standing in line or being in a crowd. And the last one would be being outside of your home alone. With agoraphobia, you fear or avoid these situations because you fear that you may not be able to escape in the event that you become panicked, or in the event that you have some other incapacitating or embarrassing symptom. An example of this could be a person who manifests anxiety with nausea. So let's look at Tom. Every time he gets an attack of anxiety, he feels dizzy and thinks he's going to faint. He also starts to feel very nauseous and thinks that he's going to throw up. So Tom does not like to attend office meetings because he fears he'll get in the meeting and throw up in front of people. Another example is an elderly person who fears falling. So this person may avoid situations outside of their home because they fear that they'll fall in an unfamiliar environment and not be able to get help. Another aspect of this is that you actively avoid the situation or require someone to accompany you in a situation. Unfortunately, agoraphobia tends to be pretty chronic, and more than a third of the people who get agoraphobia become completely homebound and unable to work. It's often associated with panic disorder, where people have attacks of anxiety, and because of the anxiety, the person fears being out in these situations, having an anxiety attack, and they can't escape or they can't get help for it. If this is the case, you would be considered to have panic disorder with agoraphobia. But agoraphobia can be its own entity and that can occur all by itself. That would be like in the case of the elderly person who fears falling. They don't necessarily have big eruptions of panic attacks. Their fear is about being somewhere and falling. So therefore, the agoraphobia works into where they avoid a bunch of stuff because of that fear. Because you might say, well, that's a reasonable concern. And of course it is. But if you get to the point where you're homebound because of the concern that you just may fall and there'll be no one there, or you can't do anything about it, that would be considered agoraphobia. So what can people do to get help? The treatment for agoraphobia is cognitive behavior therapy with or without medication. The kind of cognitive behavior therapy is typically exposure therapy with or without cognitive restructuring. With exposure therapy, the goal is to desensitize you to the thing that you fear. And it's a standard treatment used for other phobias as well, because the more you avoid the thing that you fear, the bigger the monster becomes. Now, with exposure therapy, you wouldn't just be thrown back into the situation that you don't want to be in. You and your therapist would come up with a hierarchy of fears. So you would come up with a list of situations from least anxiety provoking to the worst possible scenario that you can imagine. Then you would little bit by little bit expose yourself to these situations. Now, depending on what kind of situation it is that you need to be exposed to, the exposure can be a real one where you actually go to the place, or it can be an imagined exposure where the therapist helps you create the scenario in your mind because it's not one that's practical for you to actually be in. An example of this would be someone who has post-traumatic stress disorder from combat. It's not practical to put themselves back in actual combat, so they create a scenario in their minds that's similar to the situation. There's also a technology now that stimulates virtual reality. It stimulates or simulates the scenarios to help people re-expose themselves to these anxiety-provoking situations. And it's called virtual reality graded exposure therapy. I think it's more commonly used with military personnel, but nevertheless, it's an emerging field that will probably become more popular in time. Another common therapy approach for agoraphobia would be cognitive restructuring. Cognitive restructuring helps identify unrealistic or irrational beliefs that you have about your situation. We call these cognitive distortions. An example of a cognitive distortion is catastrophizing. Catastrophizing involves assuming the worst case scenario every single time. Even if you've never gotten close to experiencing the worst case scenario, each and every time you think this is the time that it's really going to happen. And with agoraphobia, many times there's a lot of cognitive distortions around your phobia that a therapist can help you work through. For some people, cognitive behavior therapy is sufficient to treat their agoraphobia. But in more severe cases, like someone who's completely homebound or someone who just needs a faster recovery than they can get with therapy, medications may be the way to go. Agoraphobia is an anxiety disorder, so the medications we use are antidepressants like Zoloft, Lexapro, Cymbalta. Because antidepressants don't work immediately and can take weeks to see their effect, sometimes you may be started on a benzodiazepine like Klonopin or Ativan to help reduce your anxiety in the meantime while the antidepressant takes its time to take effect. Then, once you're stabilized on the antidepressant, the Klonopin would then be tapered off. So that's agoraphobia and how we treat it. It can be pretty life-altering, so getting help can make a huge difference in how you feel and the quality of your life. If you know someone who could benefit from this video, please share it. And leave me a comment, even if it's just to say hi. Take care. See you next time.
Life for the next one.